Hi, everyone. I'm Brittany, and today I will be discussing Chapter 11, Nonagenarians, from our Microtrends Square book. This chapter explores one of the fastest growing populations in America, people in their 90s. I will be going over what the authors say about this demographic trend, along with some short and long-term health effects, healthcare challenges, and opportunities this growing population presents. What is a nonagenarian? A nonagenarian is someone between the ages of 90 and 99 years old. This age group is said to be one of the fastest growing age groups. According to the authors, advances in healthcare have allowed more Americans to reach this milestone than ever before. But why do they live longer? Medical advances, better nutrition, improved public health, and better management of chronic diseases. Improvements in medications, vaccinations, disease prevention, and healthier lifestyles have all contributed to increased life expectancy. So what does our book say? The main idea that the authors argue is that nonagenarians are no longer rare. More Americans are living into their 90s, which is kind of scary. I'm not exactly sure if I want to live in my 90s or not. Aging is also changing family structures. Families are increasingly having to care for parents and grandparents well into their 90s. Older adults are remaining active longer. Many adults continue participating in their communities, volunteering, and making independent decisions much longer than previous generations. The book also says that society must adapt to this older population and that retirement is becoming more individualized. I hope they add me into that retirement plan. But why does this trend matter, you may ask? This demographic shift impacts nearly every part of society. The increase in nonagenarians affect healthcare and families. The healthcare systems are seeing more patients with multiple chronic illnesses, while families are balancing caregiving responsibilities with work and raising children. Housing and transportation. This also needs to become more accessible for older adults. Government programs and long-term care facilities. From my experience working in long-term care, I have seen this trend firsthand. When I first started nursing, it was less common to care for people in their 90s. Today, I have several residents well past their 90s, and I've also had a couple live past 100, and they were thriving. If I have to live to this age, I can only wish to live like they did. People are living longer, but many require specialized nursing care to maintain their health, independence, and quality of life. Common health conditions that nonagenarians experience. Although many people in their 90s remain active, aging increases the risk of chronic illnesses such as heart disease, hypertension, diabetes, arthritis, dementia, hearing and vision loss, and osteoporosis. Many of these require ongoing medical management and frequent healthcare visits. I do not have a single resident, nor can I recall any in my past 12 years working in a long-term care facility that has only had one health condition. Most people have multiple comorbidities, and caring for these residents requires careful monitoring because changes in one condition often affects another condition. Mental health, such a big topic and issue. Mental health is equally important, and from working in a long-term care facility for so long, I have realized how easily overlooked it is, and it's super, super sad. Common concerns include depression, anxiety, loneliness, social isolation, grief, and a cognitive decline. Protective factors include family support, social engagement, and community involvement. Losing a spouse or a friend or a loved one can increase feelings of loneliness, while maintaining social connections can improve emotional well-being and reduce depression. In addition to working with older adults, I also care for residents with psychiatric issues. Mental health is just as important as physical health, regardless of your age. Many older adults experience depression, anxiety, or confusion that can easily be overlooked if healthcare providers only focus on the physical illnesses. I've seen and experienced this firsthand, how loneliness after losing a loved one or becoming less independent can contribute to worsening mental health. I've been there, done that, still struggle with it. I lost my sister 12, 13 years ago, and it still seems like yesterday. So I totally advocate for the mental health. Providing emotional support, encouraging social activities, and simply spending time listening can make a meaningful difference. This slide focuses on short-term health effects. Some examples include increased fall risk, increased hospital admissions, medication complications, decreased mobility, and a greater need for rehabilitation. Older adults often recover more slowly after illness or injury. Sometimes I really wonder about that statement because I have residents where I work that have fallen and broke a hip, and the next day they are wanting to get up and walk around like nothing happened. And here I am thinking, if I just fell and broke my hip, I would just want to like rot in the bed for the next 3 months. Like, do not try to get me up. But I guess that's where our generation and their generation is completely opposite. Um, Falls remain one of the leading causes of hospitalization in this age group, making prevention a major healthcare priority. Falls are a super big concern where I work. Even a minor fall can result in a hospital visit, surgery, or a permanent decline in independence. Excuse me. I've learned that simple interventions like ensuring my residents wear proper footwear, keeping their rooms and hallways free of clutter, providing adequate lighting, and frequently checking on them can significantly reduce our fall rate. And now we'll discuss some long-term health effects. Growing nonagenarian populations may lead to a greater demand for long-term care, more dementia care services, higher healthcare costs, increased caregiver burden, and workforce shortages. As more people reach their 90s, healthcare systems will need additional nurses, physicians, therapists, and caregivers. Long-term care facilities and home health services will likely continue to expand. One thing that I have personally noticed over the years is that many residents are living longer with chronic illnesses and dementia. While this is a positive reflection of advances in healthcare, it also means residents often require years of ongoing nursing care. Long-term care facilities are caring for residents with increasingly complex medical and behavioral needs, which highlights the growing demand for skilled nurses and caregivers. The effects this trend has on families. Some of the challenges include caregiver stress, financial strain, balancing careers and caregiving, and emotional exhaustion. Benefits include strong family relationships, intergenerational learning, and shared experiences. Families often become primary caregivers. While caregiving can strengthen family bonds, it may also create emotional, physical, and financial stress. One of the most rewarding parts of my job has been building relationships with my residents and their families. Many family members experience guilt, stress, or sadness when placing their loved one in a long-term care facility. I think about that all the time. What happens when this time comes for me and I need to make a decision whether or not to place one of my parents in a long-term care facility? And I will just say that working in a long-term care facility will definitely change your perception on it. As nurses, we not only care for the residents, but we also provide education, reassurance, and emotional support to families during what is often one of the most difficult times that they'll ever experience. The impact this trend has on nursing. Nurses play a major role by preventing falls, managing medications, promoting nutrition, monitoring chronic illnesses, supporting caregivers, and providing end-of-life care. Nurses are central to caring for nonagenarians. They assess functional status, prevent complications, educate families, and advocate for patient-centered care. My experiences have shown me that nursing involves much more than administering meds. Every day, I assess residents for little changes that may indicate infection, dehydration, pain, or worsening dementia. I also work closely with physicians, therapists, my social workers, and their families to develop individualized care plans. Caring for older adults requires patience, strong assessment skills, teamwork, and compassion. Public health implications. Healthcare systems need more geriatric specialists, amen, better preventative care, amen again, expanded home health services, I'm sure another amen, increased caregiver support, absolutely amen, and more dementia resources, all the way amens. Public health initiatives must prepare for an aging population by expanding preventative services, improving access to community resources, and supporting family caregivers. Based on what I've experienced over the past 12 years, I truly believe that our healthcare system needs more nurses who specialize in geriatrics and mental health. Um, there's a difference in just a nurse and then a nurse that has experience with geriatrics and mental health. That's just my opinion. You really gotta love it to do it. As the number of nonagenarians continues to grow, we will need more long-term care facilities, memory care units, psychiatric services, definitely the psychiatric services, and home health resources to meet their needs. Technology and healthy aging. Boy, this is a fun one. My mom messages me all the time. Brett, your mama don't know how to exit out internet. And I'm just like, oh, they really need to put an age limit on technology. No, I'm just kidding. I'm just kidding. But some examples include telehealth medication reminders, smartwatches. No, I don't think smartwatches should be on this list because just from my experience, my mom and my grandmother do good using their cell phones. So smartwatches, and you just scratch that one off. Fall detection devices and home monitoring systems. Technology can help older adults remain independent, and boy, it can confuse the ever living crap out of them too. Devices that detect falls, like a life alert, or ones that remind patients to take their medications, can improve safety while allowing many seniors to remain in their homes longer. Now, that I could see, but the smartwatches and stuff, no, 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 no. Real world examples. Many long-term care facilities use interdisciplinary teams, focus on fall prevention, encourage mobility, promote social services, and manage dementia with person-centered care. In long-term care settings, interdisciplinary teams collaborate to provide comprehensive care. Activities that encourage mobility and social interaction help maintain function and improve quality of life. From working in long-term care, I have cared for many residents with advanced dementia who become anxious or agitated because they are confused or frightened. I've learned that approaching my residents calmly, speaking slowly, validating their feelings, and redirecting their attention is often much more effective than correcting or arguing with them. Most of them are going to win the argument, so never argue with them. These person-centered communication techniques help reduce behavioral issues while preserving the resident's dignity. I've also cared for psychiatric residents whose mental illnesses require individualized approaches, reminding me that every resident deserves care tailored to their unique physical, emotional, and psychological needs. Future trends. What we can expect. More Americans living past 90, a longer life expectancy, increased need for geriatric nurses, greater emphasis on healthy aging, and an expansion of community-based services. The aging population is expected to continue growing. Preparing healthcare professionals to meet the unique needs of older adults will become increasingly important. In conclusion, the key takeaways from our book is that nonagenarians represent a rapidly growing population. A longer life expectancy brings both opportunities and healthcare challenges. Nurses will play an increasingly important role. Families, healthcare systems, and communities must adapt. Chapter 11 in our Microtrends Squared book highlights that reaching one's 90s is becoming more common. While this reflects advances in medicine and public health, it also requires healthcare systems and families to prepare for the complex needs of our aging population. Supporting healthy aging, independence, and quality of life will remain essential priorities. Reading this chapter has reinforced what I've experienced throughout my career. During my 12 years in a long-term care facility, I have watched the number of residents in their 90s continue to grow. While they often face multiple medical and cognitive challenges, they also demonstrate remarkable resilience, wisdom, and strength. This chapter reminds me that successful aging is not only about living longer, it is about preserving dignity, independence, and quality of life. As I continue my nursing education and work toward becoming a nurse practitioner, I hope to advocate for older adults by providing compassionate, evidence-based care that addresses both their physical and mental health needs. Thank you. And here are my references. I hope you all enjoy and I didn't bore you. Y'all have a good week and good luck on the rest of your future endeavors.